So there's some pretty concerning news developing out of Ethiopia that you might have seen.
Yeah, these reports about health professionals being detained.
Exactly. Over 80, according to some sources. We wanted to, unpack this a bit today.
Okay.
For this deep dive, we're really focusing on a detailed report from BBC News Amharic. It seems to lay out quite a bit.
Right, trying to understand the what, the why, and maybe the what next.
Precisely. The goal here is to get to the core issues, understand the perspectives, there are clearly different sides here, and just grasp the potential implications.
And we're mainly drawing on this one news article for the details.
Yeah, primarily this BBC piece. It seems quite comprehensive.
Yeah.
So let's get into it.
Okay, so the first thing that really stands out is that number. Over 80 health professionals.
That's a huge number.
Yeah, reportedly detained across the country. And the timing seems significant. It's linked to these recent partial strikes they were holding.
Right, so it wasn't just like one city.
No, the report suggests it was nationwide, but especially hitting hospitals in the major cities.
And these weren't amicable encounters from the sounds of it.
Not at all. Security forces were involved, apparently, and there are even mentions of harassment.
The report gives a specific example, doesn't it? Gondar University Hospital.
It does. That one really brings it home. 23 health professionals reportedly taken from Gondar University Hospital.
23. And the circumstances?
Well, the report details them being taken from their residences on campus around midnight. This was Thursday, May 7th, Ethiopian calendar.
Which is, what, mid-May 2025 for us using the Gregorian calendar?
Roughly, yes, mid-May. And the forces involved. It mentions defense forces, riot police, and militia members.
Wow, that sounds like a significant operation.
The descriptions are quite stark. Forceful, even humiliating detentions, according to the report.
That's deeply concerning. And it wasn't just Ethiopian nationals either.
No, that's another point. They specifically mention a Sudanese doctor, Dr. Abraham Apok. He's a gynecology and obstetrics resident there.
So this could have wider implications internationally even.
Potentially, yes. And it wasn't just doctors. The report says 9 of those detained were women.
Okay.
And the professions included doctors, yes, but also nurses, lab technicians, really the whole spectrum of hospital staff.
Which obviously puts a huge strain on things.
You'd have to assume so. And then there are these claims that hospitals were actually surrounded by security forces.
Surrounded? Why?
The report says allegedly to intimidate the remaining health professionals.
You can just imagine the atmosphere that creates.
Yeah, it's intense. And maybe the most worrying part. They reportedly arrested professionals who were actively providing emergency care.
Seriously, people working in the ER.
That's what the report states, which understandably led to service disruptions. The movement itself warned about a potential crisis brewing because of this.
So how solid is this number, the 80 plus?
Well, the BBC News Amharic report says their team saw a list. By Friday afternoon, it apparently had 81 names. And it wasn't just names. It included workplaces, professions, dates of arrest, the region, quite detailed.
Right. So let's step back a bit. What led to this point? What were the health professionals actually asking for?
Okay, so the group is called the Ethiopian Health Professionals Movement. They had a list of demands, 12 points, apparently.
And what was on the list? Was it just about money?
Pay and benefits were definitely key points, yes. But it wasn't only that. They were also asking for, broader systemic changes in the healthcare system itself, things they felt needed fixing.
And they felt strongly enough to take action.
Yeah.
When did this partial strike start?
May 5th, Ethiopian calendar. Again, that's mid-May for us.
And it had an impact.
Seems like it. The report mentions major hospitals in Addis Ababa, like Black Lion and St. Paul's, were affected.
So a partial strike. What does that typically mean in this context? Like emergencies covered, but other things stopped?
That's usually the idea, yes.
Okay.
Maintaining essential services while halting routine procedures or clinics to make a point.
But they were planning to escalate.
That's what the report indicates. They felt the government wasn't responding positively to the partial strike. So the plan was to move to a full strike starting the following Monday.
Okay, so that really sets the stage for the government's reaction then.
Exactly. It provides crucial context.
So how did the government respond initially? Any comment on the arrests right away?
Not immediately, according to the article. But on Thursday night, the health ministry released a statement.
And?
What did it say?
It was pretty blunt. Called the partial work stoppage unacceptable.
Unacceptable. Okay. No room for negotiation there, it sounds like.
Well, the tone was interesting. They said they'd been patient with the movement.
Implying they felt their patience had run out.
That seems to be the implication. And crucially, they threatened legal action
Against who?
against health professionals absent from work and also anyone they deemed to be creating chaos and disorder.
Wow. So drawing a hard line. How did the movement take that?
The organizers quoted in the report called the ministry's statement unexpected and political.
Political, meaning they felt it wasn't really addressing their core issues. That seems to be their interpretation, yes. More about cracking down than finding solutions.
And were there other pressures being applied besides this official statement?
Yes, the report mentions other things happening. Hospitals were apparently issuing their own warnings about administrative action for absences.
So pressure from their direct employers, too.
Exactly. And even reports of residency programs telling resident doctors they had to leave university housing.
Kicking them out, that's intense.
It suggests a coordinated effort, perhaps, to break the strike.
How did the movement organizers describe this overall response?
They used strong language, called it contemptuous and unbecoming of a government.
Strong word.
And they made some very serious accusations against the government, too. Things like public beatings, disrespectful language, serious threats, intimidation.
These are incredibly serious allegations. It sounds like a really volatile situation.
It certainly appears that way. And if you look at some related reports mentioned...
Yeah, there were other articles referenced.
Briefly, yes. One mentioned an earlier arrest of 15 health professionals around May 15th Gregorian time. So this wasn't entirely out of the blue.
Right, a precursor maybe.
Possibly. And another article, interestingly, titled something like, "My Wife and I Farm with TEF, Health Professionals and Their Lives That Led to Bitternesses."
Suggesting deep-seated economic hardship.
Exactly. It points to the difficult living conditions, the socioeconomic pressures that might be fueling this. That was dated around May 13th.
Okay.
And that same date, May 13th, was apparently when the initial report came out about them announcing the partial strike.
So the timeline is quite compressed there.
Yeah.
Announced strike, article about hardship, first arrests, main arrests.
It seems to have escalated quickly. There was also a mention of another piece looking at the strike's legality under Ethiopian law. So there are legal dimensions, too.
Right. So the government's strong reaction, the arrests, came right after the work stoppage started, driven by these demands about pay and system problems.
That seems to be the sequence of events described.
Okay, so just to sort of wrap our heads around this,
Yeah.
we have this BBC News Amharic report detailing potentially over 80 health professionals detained in Ethiopia.
Right, amidst this partial strike over pay, benefits, and importantly, wider system reforms.
The government's stance seems very firm, calling the strike unacceptable, threatening legal action.
While the movement sees the government's response as, oppressive, dismissive, and this threat of a full strike was looming.
And the human element here is stark, the way the arrests reportedly happened, pulling emergency staff.
Absolutely. The potential impact on healthcare delivery is, well, it's alarming. The report really paints a picture of a situation escalating fast.
With potentially huge consequences for everyone involved, the professionals, the government, but most importantly, the Ethiopian people needing care.
Exactly.
It really makes you think, doesn't it? Given these opposing, seemingly rigid positions, what are the potential long-term consequences for the healthcare system, for citizens' well-being?
It's a critical question, what happens next?
And it taps into these much bigger global issues too, doesn't it? About the rights, the conditions of essential workers everywhere. What happens when that dialogue breaks down so severely?
Definitely something to watch. A very significant development with potentially far-reaching implications.